and healthcare business news for today, 4th April 2026. 1. The lead, rising healthcare costs and budget realities. Times the big story, in India, healthcare costs are surging, making affordable insurance a critical necessity for young professionals. Major insurers like Acko Insurance, Aditya Birla, and Star Health are responding with digital-first, budget-friendly plans tailored for this demographic. Times the push for policy, industry leaders, including Dr. Azad Moopen of Aster DM Healthcare, are urging the government to treat healthcare as an economic priority. The goal is to move healthcare spending closer to 5% of GDP to address infrastructure and workforce gaps. Times operational impact, 55,000 ministerial employees in Punjab have boycotted the state's new health insurance scheme cards over provision concerns, though the health minister assures that existing reimbursement benefits will remain intact. 2. M&A momentum, the consolidation wave. Times US exit, Community Health Systems has officially exited the Pennsylvania market. They recently finalized the $459 million sale of Crestwood Medical Center to Huntsville Hospital Health System. Times India's deal surge, the Indian healthcare M&A market has crossed 10,000 crore rupees in Q2 FY26. Key recent moves include Fortis Healthcare acquiring Shri Manna Hospitals for 470 crore rupees and Narayana Hridyalaya expanding into the UK with a £183 million acquisition of Practice Plus Group Hospitals. Times the why, experts note that scale is becoming critical to survival in 2026 as hospitals move toward high-acuity care and advanced diagnostics. 3. Digital transformation, AI beyond the hype. Times workflow integration, Epic's AI assistant, ART, is now reported to cut clinical documentation time by up to 32% and speed up discharge summaries by 20 to 30%. Times the digital twin trend, CVS is exploring agentic twins AI models that simulate patient behavior to test new workflows and medication adherence strategies before a physical rollout. Times regulatory milestone, ACMA's rule is finalizing the phase-out of fax machines and paper claims, a move expected to save the industry $781 million annually through digital standardization. 4. Workforce and operational resilience. Times staffing shortages. Globally, the healthcare sector is bracing for a projected shortage of 4.5 million nurses by 2030. To combat this, hospitals are pivoting toward virtual nursing and AI-powered predictive staffing to reduce burnout. Times safety first. In local news, Madhapur Hospital, Hyderabad, conducted a major fire safety drill today to test coordination among doctors, management, and security personnel. Times leadership moves. Rajiv Gandhi Cancer Institute, RGCIARC, has appointed Dr. Dharmendra Singh Gangawar as its new CEO to lead its next phase of governance and patient-centered growth. 5. Closing call to action. Times summary. Whether it's the 10,000 crore rupees deal surge in India or the $781 million saved by going paperless, the message for 2026 is clear: scale and speed are the new benchmarks. Times the question, with hospital margins tightening, are you seeing AI as a genuine cost saver in your facility, or is it just another expensive line item? Actionable next steps. Times Deep Dive, review the full Deloitte 2026 Global Health Care Outlook for detailed regional growth projections. Times Market Analysis, monitor the JP Morgan Healthcare Conference updates for the latest on GLP-1 drug pricing impacts on hospital revenue. Would you like me to focus more on specific hospital financial reports or international healthcare policy changes for your next segment? CTA, which of these trends will have a major impact on patient care this year? Let us know in the comments. Subscribe to my channel for more. Disclaimer: the information must be verified before use. The creator, publisher and YouTube will not be liable for any negative consequences.